Hello, and welcome to CMS You. I'm your host, Christopher Semide. Each month, we here at the Centers for Medicare and Medicaid Services, or CMS, bring you the latest information and helpful tips about healthcare. CMS is the government agency that administers Medicare and oversees Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. In honor of LGBT Pride Month, which celebrates the anniversary of the gay civil rights movement of 1969, we are dedicating today's show to lesbian, gay, bisexual, and transgender, or LGBT health. Today's guests are team members from Callen-Lorde Community Health Center. Callen-Lorde, a federally qualified health center, prides itself on providing sensitive, quality health care and related services targeted to New York's lesbian, gay, bisexual, and transgender communities. Mark Murphy is the manager of the Facilitated Enrollment Department and has extensive experience as an insurance navigator and a patient care associate. Jonathan Santos Ramos is the Director of Clinic Operations and Special Populations and is assisting in the clinical expansion of Callen-Lorde into the outer boroughs. Mark and Jonathan, thank you so much for joining us today.
Thank you for having us.
Great. So I would like to start off with letting our viewers get to know a little bit more about yourselves and what has inspired you to dedicate your careers to LGBT health and also join Callen-Lorde's mission to serve the LGBT community.
So when I moved to New York, I decided that since I was starting a new life and a new career, I wanted to dedicate myself to working in the community. I saw that there's such a great need within our community, which you don't really even see until you get into working in the community. So what really keeps me going is just knowing that the work that we're doing is so important and it's helping so many people. You know, we see it every day when we're even just in my department, enrolling people in health insurance because, you know, some people haven't had insurance in a really long time. So.
And for me, I started doing HIV prevention work as a peer educator in '94. Okay. And so I've been working in and with the community since then. This is my second time around with Callen-Lorde. I was there previously for about 9 years.
Okay. And what were you doing during that time?
I was Director of Prevention, Outreach, and Education. Okay. And I returned, well, I left to see what the rest of the world was like, decided that Callen-Lorde was a better place. Okay, and so now I'm back.
Okay, great. So in your own words, what exactly is Callen-Lorde and when was the organization formed, and if you could talk about where it's located in the city?
Sure. So Callen-Lorde currently has 3 sites, 2 in Chelsea, our main site on 18th Street, our Via Spire on 17th Street, and then July of last year we opened the Bronx, Callen-Lorde Bronx in Morrisania. Okay. We started around the time of Stonewall with 2 volunteer-based organizations, St. Mark's Community Clinic and Gay Men's Health Project. They merged to serve the community, to provide the services that they felt were lacking in healthcare. We then moved to merging and becoming Community Health Project in 1983. And then renamed Michael Callen Audre-Lorde Community Health Center, Michael Callen being an HIV/AIDS activist, and Audre-Lorde being New York State Poet Laureate, as well as a longtime breast cancer survivor, when we moved to our 18th Street location in Chelsea.
Okay, so are you both working at the same center, or are you at one and you at another, or how's that?
We're both in multiple locations.
A little bit of everything.
Yes, so I have a team that goes to different locations, both Callen-Lorde locations and also locations outside of Callen-Lorde to do health insurance enrollment. So I'm going to all of our different locations for meetings as well. Sometimes I'll be up in the Bronx. Okay. Sometimes I'll be at our main 18th Street location, but my permanent location is at one of our admin offices offsite.
Okay, great. So why do you feel that Callen-Lorde is so important? Why is it that an LGBT person or an LGBT person within this community should get specialized healthcare, and why is it important for someone based on gender identity or sexuality have specialized services?
So I think that although there's been tons of progress in our society for LGBTQ folks, we still have a lot of discrimination and stigmatization in the community for a lot of our patients. And so they find a place that is both sensitive and culturally attentive to their needs. And so what we know is that when folks experience discrimination in healthcare, they're less likely to go to the doctor.
Right.
You don't necessarily want to go someplace that you don't feel accepted.
Exactly.
And because of that, a lot of LGBTQ health disparities are much greater because they're not accessing proper care. And so we exist to fill that gap, to give that sensitive space, to allow folks to access care where they feel understood.
Exactly, totally understood. Okay. And do people need to have health insurance to access the services at Callen-Lorde?
So no, while we do have the facilitated enrollment department to assist people with enrolling in insurance, we also have a sliding fee scale program where your appointment cost is based on your household size and income. So your appointment will cost anywhere from $20 to $100, and then you'll pay for your lab separately.
Okay. So you could also apply for, I'm assuming, Medicaid there? And,
Yes.
And what's that process like? Do you have to make an appointment? Do you call in?
So for our patient population, we allow them to walk in. We'll have 1 to 3 navigators available for walk-ins at any given time. And you'll be able to sit down with an insurance navigator, and then you'll go through the application process on the New York State of Health Marketplace. And that involves entering your personal identifying information and that of everyone else in your tax household. So who you apply for, who you file your taxes with. And then you'll also enter the income information if you're applying for financial assistance, which is how you would get either Medicaid, Essential Plan, or a tax credit to apply to your monthly premium. And then once all of that information is put in, then the marketplace will give you a determination. Sometimes they'll hold off on your determination and ask for proof of some of the information that you entered because they compare that information with the Federal Data Services Hub. And so that information is electronically compared. And then once there's a match, they'll give you an eligibility determination, again, based on your household size and income. And then we'll be able to help patients select a plan. Sometimes it requires calling around to your specialists to make sure that they accept the same plans that we accept.
Okay, and do you keep, sometimes do you keep a relationship with these people that you apply? Is a lot of back and forth, or is it like a one-bam, one-stop shop?
Yeah, I've actually been doing enrollment for a few years now, and I just received a call from my, I think, 3rd applicant maybe a week ago.
It happens, you connect. You connect
Yes,
with people. That's great.
And
they want to stay with you.
And regardless of insurance, we do accept anyone. If they're not eligible for insurance, we're here for the LGBTQ community and all of its diversity, regardless of ability to pay.
Okay. So you mentioned LGBTQ.
Yes.
So let's talk a little bit about that. What does that Q stand for in that acronym?
So the Q is queer, and queer theory came out of sort of the women and gender movement several decades ago, taking back the word. For many older generations, it's derogatory in some way, and many folks are taking back that word and claiming it as their own.
Okay, great. So what are some of the common challenges that you find with the patients at Callen-Lorde? Are there specific things that you hear commonly that are always, that you're always like, this again, something like that? Can we talk about that?
So there's not really, I guess, a common theme of issues with patients, but we often will see people that have a history of trauma from the experiences in their life. Oftentimes a lot of the transient population are homeless because they were rejected by their family. And so that will lead to, I guess, a fear of rejection at any other place that you're at, And so whenever there's an issue where maybe your appointment was scheduled for a different time than you remember, you may feel that we're rejecting you, and so then you're not able to fully comprehend the situation that's at hand, which could simply just be, it's actually in an hour or so,
And I think a lot of our patients are coming in, unfortunately, one thing we do hear way too often is denial of services. There are providers who refuse to, especially in our transgender, TGNC, gender nonconforming communities, they will seek transgender care, hormone therapy, things of that sort, and will be straight out denied. We hear a lot of times with our men who have sex with men looking to go on some biomedical prevention such as PrEP, pre-exposure prophylaxis, where they're denied by their provider who won't provide that medicine or that regimen. And so there's also this level of denial in the healthcare community, unfortunately, for a lot of our LGBTQ folks.
Right. Which leads to, a stigma, so to speak. So, going back to those transgender-friendly providers, are these providers actually at Callen-Lorde, or do you refer these patients to providers within the community?
Yeah, so we have a very well-rounded staff of medical providers that can see people for all of the needs in our community. And then if there's anything like specialty care, then we also have a referrals department that can relay people to different specialists.
Okay, great. So going back on the stigmas that you see a lot of patients unfortunately have at Callen-Lorde, is there anything that, the surrounding community can do? Do you think it's due to a lack of education or support, or what type of outreach does Callen-Lorde do to kind of like lessen the stigma that the LGBT community has?
So we do a lot of different advocacy in different capacities. We definitely advocate for our communities on the city, state, and federal levels. We have a team of training folks that go out and train different social and health agencies to be more sensitive. So we're not only looking for those sensitive providers like the specialty folks that Mark mentioned, we're going out and educating the providers.
That's great.
So that we can ensure that our patients are having a culturally sensitive experience with them.
Great, great. So, with the unfortunate rise in LGBT youth bullying due to social media, and unfortunately suicide, what type of services are provided at Callen-Lorde for this vulnerable community?
We actually have a whole department dedicated to the youth. It's the Health Outreach to Teens program, and they're basically a microcosm of Callen-Lorde, all dedicated to youth. There's case management, there are separate medical providers, there's mental and behavioral health involved as well. So we have a whole department just catered towards the youth and making sure that we're able to connect them to whatever services they need.
Great.
And that interdisciplinary team is not only on site, but also through our medical mobile unit. So we're out in the streets and we're going to street youth to go where they are to try and get them to come in, but if not, continue to go meet them where they are. And so that interdisciplinary team also provides those services on the medical unit as well.
And are there any services for, let's say, parents of LGBT youth that are kind of confused or have questions or need some guidance to approach, their youth with these questions and these issues per se?
We have a very robust, as Mark said, referral team and community partners. We know that we can't be everything for everyone.
Right.
And so we have a strong network of partners that allow us to connect to services that we may not offer. But we do have a strong talk therapy group of well-experienced social workers who can provide some family counseling in those situations, and anything outside of our scope and not appropriate for our folks, then we refer to one of our community partners.
Great, great. So in regards to the older members of the LGBT community, are there any kind of specialized services offered to LGBT seniors?
So we do, again, have a case management department at Callen-Lorde, and any services that we necessarily can't provide, such as enrollment into Medicare. We have a network of, service providers outside that we can refer people to as well.
Okay, great. Do you guys partner up with, organizations like Meals on Wheels or
We partner with Sage,
Okay,
absolutely.
okay.
As I mentioned, sort of we all do the work together, right?
Awesome.
And so I think in a lot of what we do is piecing it, right? And really coming together as a whole network and not just sort of siloed entities.
Exactly.
We also have a senior advisory board,
Okay.
a CAB, Community Advisory Board for our older folks, and we let them tell us what services they need, and then we go figure out if we can't provide it, who's providing it, to make sure that we're strengthening that network.
What are kind of like the most common things that seniors are requesting or need, you would say?
Definitely enrollment assistance into Medicare. It's a tricky system sometimes. And then also just, I guess, sometimes assistance with, what is it called? Social Security income, disability income, cash assistance sometimes. So some things that are, I guess, involved in some of the other departments that we have, like, because sometimes in my department, people will ask us about assistance with enrolling into Social Security. So definitely some of those kinds of services, which we also can refer people to other centers that we know of as well.
And we've also heard from our seniors that, day programs or food programs that are sensitive to them. A lot of them, unfortunately, have to go back in the closet in order to access these services. And so really creating spaces for them is extremely important.
Exactly. So what are some specific health concerns that are common, for Callen-Lorde patients? And why is it vital for this community to acquire health services?
So we have mounting evidence of our health disparities. Unfortunately, there isn't much research out there. And so we really try as much as we can to collect as much data with our own populations, but also encourage institutions to study us so that we can better understand what's happening. But I think that, for instance, with sort of different parts of our community, transgender women, Latina, and Black are at higher risk of contracting HIV. We have, when you think of 40% of New York City's homeless are youth, our LGBT youth out on the streets are contracting chlamydia at higher rates. Our women who have sex with women are more likely to smoke, to have type cardiovascular issues. So there's a lot going on, but we definitely need more research to get really into it.
Great. So can we talk about some of the preventive services that Callen-Lorde provides? Is it, let's say if I'm a youth, and I have some questions, is it something that I could just walk into and speak to someone?
So for the youth, again, there's the HOT program, which they will, set up an appointment to meet with a case manager and then, eventually get into the medical portion of it where they can, learn more about their options. There's pre-exposure prophylaxis, which we also have available to the adult program. And then we also have a prevention and outreach team that does the testing. And so they'll do testing and counseling as well. And then if someone tests positive on site, we can link them into our newly diagnosed process. And then again, we have a very large, prevention and outreach program.
And we also do primary care, and so blood sugar, hypertension, sort of all of that stuff, cancer screenings are all part of our general primary care practice.
Okay. So in researching into Deshaun, also you mentioned it a couple of minutes ago. I see that Callen-Lorde also offers sensitivity trainings. So I just want to know how are those trainings formatted, and how would an organization be able to, have, a team member or a group of you guys visit their organization and start these trainings with their teams? So
we have a research and education team that coordinates that, sometimes send us out, like we're here today. And they really coordinate specific to the needs of whoever's requesting it. So anyone can call our main number, 212-271-7200, and be able to connect to that team to be able to request any sort of sensitivity training. Our clinicians and staff also do lots of research, as I mentioned before, trying to increase the written papers on our communities. So we share that research, we give presentations, we do one-on-ones, and we're part of different associations that allow us to share the stuff that we're learning about our communities.
Do you guys go out to schools or high schools? How's that? How is that reception if you do go to schools? How is that received?
So I personally haven't been to a school. However, it really just depends on, the desire from the community, whoever is contacting us for support within these different areas. Because, a lot of schools are going to eventually need to move towards having more sensitivity trainings. So, it really just depends on who's reaching out to us.
And with more schools having GSAs or gender sexuality alliances, they tend to reach out to us more. And so as that sort of grows in different schools, our request rates also increase in that way.
Great. So I know we're big on New York City because, we're here in New York City, you guys are here in New York City. But let's talk about people who, don't live in the city, that don't have this access, how do you ever come across someone who, is visiting and is asking you, I live in Utah, or I live, upstate. Let's not go too far. What do you say to a person that's, requesting, LGBT friendly services, but isn't a resident of New York City?
So a couple of things. I don't know about Utah, unless I do. But GLAMA, which is the LGBT health provider network, a national network, has an online directory. So for someone from Utah, I would say go to that website.
Bam, there you go.
Yeah, the Gay Lesbian Medical Association definitely has a very wide range of providers on their provider directory. And then, sometimes people will have like a multi-state plan and they'll be able to access services, in other states and whatnot. Sometimes people want to travel for quality care.
Okay.
And one of the requirements of being a FQHC or a federally qualified health center is that those centers have facilitated enrollers like Mark's team. And so they can direct you in sensitive directions, if you will.
Okay. So besides Callen-Lorde, which sounds like an amazing organization, are there other providers here, within the state of New York that are dedicated to LGBT health like Callen-Lorde?
We do have several partners, including organizations such as Apacha down in Chinatown and opening soon in Queens. There's other nonprofit organizations that we partner with to, depending on folks' location, our capacity to take on new patients, sort of a combination of things. So there are definitely other federally qualified health centers paying attention to our communities.
Okay, so you mentioned capacity. Is capacity kind of, it's a good thing and a bad thing. I mean, it could be like, a lot of people need these services, but yet, there's only so much of you guys in Callen-Lorde. Is that kind of like a challenge for your organization? And what are you guys doing about that?
It can be, and the solution is constant expansion. As you expand to fit the needs of our community. Right now we're working on some things and we're continuing. We just reopened our panels.
So we opened our Bronx site in July of 2016, and in the first 6 months, even without going out there and advertising or actively recruiting in any way, we saw almost 900 unique patients.
That's awesome.
And it's a tinier version of our Chelsea site. So, capacity is always an issue. Everyone knows New York City real estate is not always easy. And so the need for expansion is always there, and a difficult one, but we are happy to announce that in 2019 we will now have a Brooklyn site.
Awesome. You heard it first here on CMS You. Brooklyn coming your way. Okay, great. Growing up in the Bronx and being a member of the LGBT community myself, I wish I would have known about a community center that offered these, growing up, you had so many questions, and you don't feel comfortable. Wouldn't feel comfortable going to my pediatrician at that time. So this is great. I think the more the merrier at this point. And Brooklyn is just another great thing coming to Callen-Lorde.
Yeah, we're very, very excited.
So I know you mentioned it again, but I would like to repeat it for our viewers. If a person doesn't have an LGBT friendly provider and is looking for them, how would they go about that, and what's that process like?
So again, they can go on the GLMA website, and they'll be able to find a provider based on their zip code, and they'll be able to meet with that provider and begin their care there.
Okay.
I think as far as the way that we access most of our patients is word of mouth, and the community is your best friend, right?
Exactly.
And so folks are having experiences with private doctors or different centers that are good experiences, and so really sort of tapping into networks. And we always suggest that before you access a provider and not sure about their sensitivity, you can call and ask if they have LGBTQ patients, and see if that is sort of a gauge. If there's a huff or a puff on the other line, you may want to go a different way.
You're like testing the water, so to speak.
Absolutely, and you don't have to give your personal information to call and ask that question. So your confidentiality, is always a priority to us, and so there's no need to necessarily out yourself to find that type of provider. But we also say bring a friend. A lot of times we have really strong networks of our chosen family, and that's always a great idea if you're unsure about the environment you're walking into, to bring a friend or someone with you.
For support.
Absolutely.
Great. So how can someone get involved and support this wonderful organization known as Callen-Lorde?
Yes, so and it's great that you're asking this question right before Pride season's coming up. We have a volunteer section to volunteer with us on our website, callen-lorde.org. And, you can sign up, you can reach out to us, and you'll be able to volunteer with us. We have events coming up where also you can purchase tickets, and all of those donations and proceeds go directly to serving the community through Callen-Lorde. We have our annual Roar event, which is coming up at Central Park Zoo, and those tickets are available on our website as well.
And if you can't afford a ticket, we always need volunteers at the events. And so you can, again, contact us through the website, and you can volunteer at the event and get free admission.
Awesome. That sounds so great. Thank you guys so much for your insightfulness and all the tips that you shared with us. We really, really appreciate it.
Thank you.
I would like to thank Mark and Jonathan again, both for being our guests today here at CMS You, and we deeply appreciate your time and the healthcare information offered to such a diverse and colorful community that makes our city great. If you or someone you know needs more information regarding LGBT health services, supports, or resources that are provided in a safe and judgment-free zone, please visit callen-lorde.org or contact them directly at 212-271-7200. For assistance with health insurance enrollment, contact their healthcare navigators at 212-271-7270. Please also visit outtoenroll.org for more LGBT-friendly resources. There you can find frequently asked questions related to LGBT health and additional information on LGBT supports and services. For national LGBT health news and reports on public efforts pertaining to LGBT wellness, please visit cdc.gov/LGBT health or call the Centers for Disease Control and Prevention directly at 800-232-4636. We hope that today's show has inspired you to either seek or recommend to a friend or family member healthcare services that are quality-driven, supportive, and culturally sensitive. We support Callen-Lorde's mission to close the gap in health disparities for the LGBT community through advocacy, education, and research. If you'd like more information on your state's marketplace or Medicaid programs, or you'd like to find general healthcare insurance assistance in your local area, please call 800-318-2596 or visit healthcare.gov and select your state. Remember that health insurance helps protect our loved ones, ourselves, and allows us to get the care we need to stay healthy, regardless of sexual orientation, gender identity, or race. I'm Christopher Semide, and on behalf of Mark Murphy, Jonathan Santos Ramos, and all of us here at CMS, thank you for watching. Until next time, be well. Thank you guys so much. Awesome.
Thank you.
Thank you guys.